Hi everyone, this is Neel Raithatha, also known as the Wax Whisperer. Thank you for joining me in my latest video. I have here a couple of cases that involve me removing dead skin from the patient's ears. And this is patient one. Patient one had really macerated, damp and wet skin, which was most likely caused by them being a hearing aid wearer. When you wear hearing aids that occlude the ear, they can create a lot of humidity, and the humidity and sweat into the ear can cause this dead skin to absorb that humidity, that moisture, and then become macerated and really soft. In this particular case, this patient became aware that their left ear was blocked, not because they necessarily felt their hearing to be reduced, but more so that they were experiencing what we call acoustic feedback. Now, acoustic feedback is when your hearing aid whistles and squeals at you, and it's so audible that people around you or even from a distance can hear it quite often. So acoustic feedback is when a hearing aid amplifies sounds into your ear, and that amplified sound is reflected back out of the ear. So that could be caused by earwax, dead skin in this case, or an ill-fitting hearing aid, so sound can leak back out. And if that amplified sound that's been reflected back out of the ear re-enters the hearing aid microphone, the hearing aid amplifies that sound again for a second time, and it then amplifies it back into the ear. And then for the second time, that sound is reflected back out and it re-enters the hearing aid microphone. And you can see where I'm going with this. You get a repetitive loop, and we call that a feedback loop. And it causes extremely loud, high-frequency squeal. A lot of us may have experienced it before when you're doing karaoke and you're singing next to the speaker or with the mic, and you get that squeal. And as soon as I removed the dead skin from this patient's ear, their hearing aid stopped whistling immediately. I have suggested that they use some acetic acid just to help calm the ear down again. When you've got a moist, damp ear, it can be a perfect incubating environment for bacteria and certain fungi to flourish and to colonize, so we don't want that to happen. The patient with their hearing aid, they have got a ventilation hole, so a ventilation hole allows a bit of natural air, some circulation, some aeration to reduce any humidity. It's just a chronic problem that they have suffered from for many, many years now. However, in recent years, it has significantly improved. In the past, they developed really severe otitis externa, an outer ear infection that needed prescription medication. But more recently, we were able just to manage this just by cleaning the ear on a regular basis, and the patient using some acetic acid ear spray just to calm the ear down once we've removed all the dead skin. So you can see I'm just trying to get as much of this dead skin out as possible. You can also see the eardrum. The outer layer of the eardrum is made up of the same skin that lines the inner 2/3 of the ear canal. So it's a layer of epithelial skin cells. So the epithelial skin cells form the epidermis, which is the outermost layer of skin. And you can see that skin on the eardrum, it's itself a bit wrinkly, so you can tell that it's wet and damp in this ear. The patient does wear their hearing aid as soon as they get up in the morning, last thing at night, so about 14 hours a day, and it can sometimes lead for certain patients to develop humidity and sweat. So this is patient two. So patient two also had dead skin, but this dead skin's really dry and crusty. This is their left ear. The right ear was the worst ear out of the two, and this skin wasn't necessarily, again, the patient wasn't reporting a hearing loss. Instead, they're reporting itchiness and dryness in the ear, but also a rustling, crackling sensation. They can actually feel the dry skin moving around in the ear, and I suspect that's more to do with the skin that's found on the eardrum. You can see that in the distance. So because this patient's skin is really, really dry, I've just instilled some olive oil spray just to help soften this skin, and it will just help me to then peel it away. Whereas with patient one, their dead skin was already damp and wet. We didn't really need to use any softening agents. But here I'm just using the oil just to lubricate the skin, just so I can get a bit more purchase with the sucker. So I'm going for this ball of dry skin on the eardrum now. And I've managed to just bring that away. You can see the cellular structure of the skin there. There was just some oil that had collected in the inferior recess here. So this region of the ear canal, it's got several names. One of the names often used is called the annulus. Now, the annulus actually is, can you see that white ring around the rim of the eardrum? Hopefully you'll see it again in a moment. That is that's the annulus in its truest definition. So the annulus is some fibrocartilage, and it's this white ring that forms around the perimeter of the eardrum, normally from about 2 o'clock all the way around to about 10 o'clock. And that annulus, that fibrocartilage, it gives the eardrum its kind of elasticity, its strength. We just got a bit of clarinetting there. You saw that I came out of the ear because it started to squeal a little bit, so I came out straight away. And I've managed just to peel this skin just from pulling at it, really. I'm going to put a bit more oil, I think, just to soften the skin a little bit more. So that region where I removed some of the oil, sometimes that's referred to as the annulus, but the more accurate label I would give to it is the inferior recess. So as we approach the eardrum, the ear canal narrows and then it widens back out, and it typically widens on the front portion of the ear canal and also at the base of the ear canal, and that creates a trench, a basin if you like, and that's the inferior, so inferior to the bottom recess. And then because the ear canal widens at the front section of the ear canal towards the eardrum, we call that the anterior. So anterior is always to the front, and quite often if you get water in your ear or even softening earwax drops, it can collect in the inferior anterior recess. So this is their right ear. This is a lot more dry skin, and again you can just see that texture of the skin, the cellular structure of it. And I've decided just to put some olive oil spray just to lubricate the skin slightly, and you can see that it really helps me to peel away the skin. I'm just peeling it away from the roof of the ear canal. I am using a fine end throughout, and that's with both patients. A fine end I find is a lot better to use when removing dead skin because it reduces the likelihood of clarinetting. So for anyone who doesn't know what clarinetting is when the skin violently flaps at the tip of the sucker. And it's so loud that it's not only is it audible for the patient, but it's audible to me performing the procedure, and even I can find it loud. So a fine end significantly reduces the clarinetting, it minimises it. So it's just a little bit of dry skin here. You can see it's just lodged in the inferior anterior recess. And I've managed just to get the patient in the correct position there, so I can remove that. So this eardrum is slightly more opaque. You can see that whiteness, we call that opaqueness, a bit of tympanous sclerosis, some scar tissue. Well, I hope you enjoyed those videos, guys, of the different skin consistencies. Do stay tuned. I've got a load more videos to upload in due course. Thank you. Bye.